My first sign of having pain, it was my leg, and it was my left leg, and it was a shooting pain, like a nerve pain going down like my inner thigh. The doctor told me that it was my hip, that I would need a hip replacement, that would be the only thing that would relieve my pain. And I was like, but my hip doesn't hurt. My hip never hurt.
Classically, people with true hip arthritic pain or true ball and socket pain will complain of pain in the front. Occasionally, it will be in the side of the hip or the side of the thigh, but typically mostly toward the front.
When the doctor said I had to have a hip replacement, I was scared the first time because I didn't know what to expect. I didn't know anybody that had a hip replacement. I thought I wasn't old enough to need a hip replacement.
Beth was in remarkable physical condition prior to the surgery. Physical condition makes a huge difference in the outcome of the surgery and the recovery from the surgery.
I've been teaching suspension classes probably for about 4 years now. And a suspension class, it's an all-body workout. You work every muscle in your body. It really focuses on your core, though. The motto for it is make your body the machine, that you don't really need weights, you don't need exercise machines, that you use your own body weight to get stronger.
Beth was a prize patient because she was so positive. She wanted to get better. She wanted to get better quickly, and she had very specific goals in mind. She wanted to get back as good or better than she was before. And she told me she is much better than she was before the surgery.
Shortly after my surgery, I was able to resume my activities and teaching my spinning classes and my suspension training classes. Before that, I was able to teach them, but I had to compensate, and I could, because my leg wouldn't move in certain ways, and certain things that I was not able to do, I was able to do shortly after the surgery.
We put all patients now through a course of preoperative physical therapy. Surprisingly, virtually every patient after the surgery will say, I am really glad I did the physical therapy.
Since the surgery, my life has become more active and fuller. I've been able to do all my activities. My granddaughter was born February 5th, and I'm perfectly capable of carrying her, taking care of her, helping with that, and feel very strong. Well, Dr. Myers knows I think he's wonderful, that he's a miracle worker. I don't know what people did years ago before they had this modern technology and medicine. I obviously highly recommend him to anybody who needs any hip replacement surgery or wants to get checked out if they